Everybody wants to work in healthcare today, but not everybody should work in healthcare today. The HCRA will take a look at the behavioral aptitude of each individual and then compare them to either one, if they know exactly what they want to do, or up to 25 different healthcare-specific jobs to see whether the best fit behaviorally. Many times the criteria used for admissions into a program is simply work keys or maybe even basic skills or other cognitive abilities. And yet we know from our validation and research in healthcare, behavioral aptitude is vitally important and should not be ignored. As a result, we'll evaluate very critical healthcare-related competencies to see how this person compares to their peers in those specific jobs. And where somebody has a low score, we'll actually provide some follow-up questions so you can probe that and discuss that proactively with the. The other thing that's helpful is making sure the person's perceptions of the job, what they're likely to encounter once they're on the job, are aligned with reality. Because healthcare has such unique work characteristics, we want to ask very specifically how a person would feel about performing common healthcare-related tasks. Where there's a gap, in this case, this person doesn't want to work around people with contagious diseases, or they don't want to work on call, we want to be able to talk about that and be proactive in pursuing that to make sure it's going to be a good fit for them long term. Some healthcare employers are overwhelmed with the number of applicants they receive today for certain positions. For those individuals that score well on the assessment, they'll actually receive a certificate of achievement they can present to an employer to help differentiate themselves from the applicant pool. We provide value in 6 different ways. Number 1, we can help an individual identify the optimal health career from a behavioral perspective. Secondly, we can help you conduct a best practice structured interview so they experience that, and we can talk about those things that could be career barriers in a proactive manner. If they score low compared to their peers on any of those critical healthcare competencies, again, you'll have another opportunity to discuss those in a proactive manner. They'll also receive a realistic job preview and understand some of the unique characteristics of working in a healthcare environment, what that's like, and the demands required from that. They'll also receive an individual development plan that will highlight their strengths, prescribe specific solutions for their 3 lowest ranked competencies, and help them develop an action plan to pursue those. And then if they do well in the assessment, we'll give them a certificate of achievement they can use to differentiate themselves from the other applicants in the applicant pool. So if you'd like to learn more and have a little fun too, you can click on the link on this page and it will take you to our survey site where you can complete that. At no charge. It'll take 15 to 20 minutes, and we will actually bring your feedback reports to the conference. We're booth number 4, and be happy to pass those off to you there. We can meet in person and learn a little bit more about your initiatives. If you have questions in the interim, obviously you can contact me directly anytime by phone or email. We thank you for your interest and look forward to seeing you in Mount Pleasant.